We asked gynecologists about things patients do all the time that are unnecessary or make their job harder. This is what they said. 1. When patients cancel their appointment because of their period. Doesn't matter if you are on your period. Just give a brief heads up to the doctor, but don't be self-conscious, explains Rediter N. Patchet, a primary care doctor who performs pap smears. Being on your period slightly decreases the chances that the sample will be satisfactory for analysis, but it is usually fine. I have never had the pathologist reject a sample, and I've done over a dozen paps for women on their periods. 2. When patients don't scoot their butt all the way to the base of the exam table. No one does that without prompting, but it is essential, N. Patchet continues. 3. When male partners stay in the room during the exam. OB-GYN, a Texas doctor, can't stand it when men come into the exam room with their wives/girlfriends, etc., proceed to speak for them the entire visit, ask to look in there when you are doing the pelvic, and then finally, when you have your hand on the door, reveal that the real reason they came was because he thought there was something wrong with her because she doesn't want sex as much as the guy does. Gee, I just can't imagine why she isn't all over you, buddy. Nice. 4. When patients treat mommy blogs as gospel. I love mothers and mothers-to-be who take an active part in researching their healthcare, says Gyn. These mothers are engaged and healthy and motivated to be good parents. But the minority who do that research, and are unable to make good judgments on what is and isn't a proper source for healthcare advice, is easily the population that is most annoying to deal with. It's like arguing about religion. Some hippie blog said it, so it must be true, and no amount of medical research can convince them otherwise. Again, this behavior describes a small number of women, but they command a disproportionate amount of my energy. 5. When patients expect hormones for their low libido. It's not related to hormones, it's generally related to emotional issues, says Cindy Basinski, MD, an OB-GYN in Indiana. Maybe you just had children and you're exhausted, or maybe you and your spouse are having issues with the relationship, and you feel like he's not paying enough attention to you. The only exception is menopausal women, who may notice a decreased sex drive. 6. When patients don't request a female doctor when a male makes them uncomfortable. About 1/3 of women are uncomfortable with male doctors doing the exam, admits N. Patchet. An unknown percentage of these uncomfortable patients are presumably survivors of sexual violence, in which case discomfort is entirely understandable and psychologically natural. If that is the case, there is no shame in saying I have been a victim of sexual violence in the past and would be more comfortable with a woman doctor. It is nothing personal. If you are open about your needs, I will work effusively to accommodate you, but if you just act awkward, I won't necessarily identify the issue quickly. 7. When patients apologize for unruly pubic hair or hairy legs. I see so many patients who apologize for not shaving their legs, says Maureen Mulvihill, MD, an OB-GYN in private practice in Southern California. But I don't notice, and I've never met another physician who does. 8. When patients don't get screened for cervical cancer. We all know of patients who waited too long to get help for red flag symptoms, for example, foul-smelling discharge, and wound up diagnosed with stage 4 cervical cancer, says Battaglino. Current guidelines recommend that women with an average risk for cervical cancer get screened every 3 years when in their 20s. Those aged 30 through 65 should get Pap smears every 3 years or a combination of Pap and HPV test every 5 years. 9. When patients try to hide symptoms. Our responsibility is to help our patients make good healthcare choices for themselves. Some problems can feel embarrassing, but they are problems we see every day, says Dana Jacoby, MD, an OB/GYN in private practice in New Jersey. In some cases, getting over your shyness can save your life. Nancy Lebowitz, MD, a clinical instructor at New York Presbyterian/Weill Cornell, remembers a patient who was embarrassed by a skin rash on her arm. When I asked her how long she'd had it, her answer raised a red flag. It had been there way too long. After further testing with her primary care doctor, we discovered she actually had lymphoma. 10. When patients stop using birth control because of side effects. All forms of birth control have side effects, as does no birth control. The side effect of that is pregnancy, says Dr. Pamela Behrens, a University of Texas Houston Medical School professor in obstetrics and gynecology. With this in mind, give your body plenty of time to adjust to a new treatment before deciding it doesn't work. If we could tell which was best for you by looking at you, that'd be great, but we need to give it a fair trial, Dr. Behrens says. You need at least 3 months to get used to it. 11. When patients don't disclose medications they're taking. You may not think your other medications matter to your OB/GYN after all. You're just going in for a Pap smear or to renew a birth control prescription. But your doctor needs to hear it, because both drugs and natural supplements could affect your care. For example, if she knows you take a medication for blood pressure, or an acne drug with high risks of birth defects, that could affect what type of birth control they recommend, explains Reader's Digest.